Bismillahirrahmanirrahim. Today we will have case quiz number 48. Case data: 34 years old female complaining of rash, multiple tender red swelling on chins and forearm over the last 2 weeks. Older swelling are darker, seem to be healing from the center, so the chins of the legs and the forearms. Generally unwell and tired. Pain in wrist and ankles. Recurrent ulcers over the last 2 years. So the recent history is for 2 weeks with rash over the chins and forearms, with pain and wrist over the ankle, in the ankle and the wrist, and generally unwell and tired with recurrent history of ulceration over the last 2 years. No genital ulceration. Intermittent abdominal pain and diarrhea. Moderate smoker and occasional alcohol drinker. Examination showed she is thin but looks well. No current ulcers. Joint not inflamed and full range of motion. Skin shows multiple tender lesions on the chins and the forearm. Lesions are raised 1 to 2 centimeters in diameter. The fresher lesions are red and the older one looked like bruises. Investigations were normal apart from white BCs elevated 15.4 and ESR raised. All other investigations, as you see, are normal. Hemoglobin within normal, platelet within normal, sodium, potassium, urea, creatinine, glucose, and chest X-ray is normal, and also urine analysis is normal. So, what is the diagnosis? The answer is yes, it is Crohn's disease. Crohn's disease, which is one of the inflammatory bowel disease group, IBD. This patient has erythema nodosum, in this case secondary to previously undiagnosed Crohn's disease. Erythema nodosum is due to inflammation of the small blood vessels in the deep dermis. Characteristically, it affects the chins, but it may also affect the size and the forearms. The number and the size of the lesions is variable. Lesions tend to heal from the center and spread peripherally. The rash is often preceded by systemic symptoms such as fever, malaise, and arthralgia. It usually resolves over 3 to 4 weeks, but persistence or recurrence suggests an underlying disease. However, there are many diseases which are linked to erythema nodosum, such as streptococcal infection, tuberculosis, leprosy, glandular fever, histoplasmosis, coccidiomycosis, lymphoma or leukemia, sarcoidosis, pregnancy or even oral contraception, reaction to sulfonamides, ulcerative colitis, or Crohn's disease. So Crohn's disease is not the only diagnosis for this case. It may be any one of these. However, the history of mouth ulcers, abdominal pain, and diarrhea strongly suggests that this woman has Crohn's disease. She should therefore be referred to gastroenterologists for investigations, which should include small bowel enema and colonoscopy with biopsies. Treatment of her underlying disease with steroids should cause the erythema nodosum to resolve. With no serious underlying conditions, erythema nodosum usually settle with non-steroidal anti-inflammatory drugs. The key points for this case are: patient presenting with erythema nodosum should be investigated for an underlying disease, and erythema nodosum is most often seen on the chins, but can affect the extensor surface of the forearm and thighs. And thank you very much for your attendance, and we will see you tomorrow with case quiz number 49. Wassalamu alaikum wa rahmatullahi wa barakatuh.